Hello, I'm Jeff Bernstein, Healthcare Policy Analyst for US PIRG. Thanks for watching this briefing on comparative effectiveness research as part of our Making Healthcare Work campaign. It may surprise you that for a majority of medical conditions, the most effective treatment options are unknown. Doctors certainly know how to effectively treat most conditions, but for 70 to 80% of medical issues, no research has been done to determine the most effective treatment. That means that in most instances, patients do not get the best possible care. Ineffective treatments can put patients at risk and drive up costs. Helping doctors deliver the most effective treatments to their patients will keep us well and bring costs down. The way to do that is to invest in comparative effectiveness research. As the name suggests, this is research to determine what the most effective treatment or drug or device or procedure is for a medical condition. For example, a 2007 study compared the effectiveness of different treatments for coronary artery disease. Traditional therapy involves prescription medicines and lifestyle changes like lowering cholesterol, weight reduction, and increased physical activity. In recent years, doctors have been using more invasive treatments like angioplasties and stents in addition to the traditional therapy. The study was designed to assess the additional benefits of angioplasty or stents. It found that there was no advantage whatsoever. Such additional treatments are unnecessary and ineffective. Thus, not only does the research tell us what the best treatments are for any particular condition, it helps doctors avoid unnecessary or inefficient treatments, and by so doing reduces the cost of healthcare. And in fact, in clinics all over the country, doctors are using the patient-centered research to improve medical treatment and lower costs. Comparative effectiveness research seems like such an obviously good idea. You may wonder what the controversy is. People opposed to healthcare reform are claiming that comparative effectiveness research will lead to healthcare rationing. They say that bureaucrats will be in charge of your treatment. But choosing to use the most effective treatment strategies isn't rationing. It means giving your doctor the tools to give you the best treatment possible. Ideally, doctors will incorporate such research into their medical practices. Insurers would do well to require their providers to refer to effectiveness guidelines when treating patients in order to improve care and reduce unnecessary spending. A final issue regarding comparative effectiveness research is who should perform the research. Effectiveness research is carried out today by the government, by universities, and mostly by the drug and medical device manufacturers who are seeking approval for their products. Unfortunately, there is significant evidence that studies done by for-profit companies on the products they are trying to sell are biased. It is essential that unbiased entities, such as the government, universities, and non-profit research institutions, perform this work. We don't know what the most effective treatments are for most medical conditions. Comparative effectiveness research is necessary to discover those most effective treatments, which will improve patient care and reduce healthcare costs. This research should be performed by neutral researchers.